All right, welcome back to class. Today we're going to start by covering something that you guys have already had exposure to in lab, but we've only spent just a little bit of time on it, so it makes sense that I introduce or show you this video so that you can at least have it to go over on your own. We're going to utilize my wife here, Mrs. Reese, to kind of help us out, okay? I don't call her Mrs. Reese, I call her Laura, just so you know. So we're going to start with a seated web distal humerus forearm grasp pull for a long axis restriction of the humeroradial joint. So we're going to contact the distal humerus, and we're going to use the doctor's web contact to accomplish this. Please give me some feedback as far as camera angles go. I want to try to work with you as best I can. I'm a little bit limited in what I can do, but we'll make the best of a kind of a weird situation. So we're using a web contact on that distal humerus. I'm using a grasp on the distal forearm, and I block that humerus as my patient's nice and relaxed here, and then I traction and pull. Remember though that when we did some of these palpations, we palpated the anterior aspect of this of the arm here, and we said that biceps tendon sits right in here. So we need to make sure that when our patient comes in and they have some sort of an elbow complaint, and they say, "Doc, my elbow hurts," and they just kind of grab at the elbow, we need to eliminate this biceps tendon. If this is something that we palpate, that this restriction exists, and that's something we want to correct, we want to make sure that we're not crunching down on that biceps tendon if it is something that is causing those symptoms. So again, this was the seated web distal humerus forearm grasp pull for long axis restriction of the humeroradial joint.